All right, welcome in everyone. Ready for another deep dive? Today we're going to be talking all about something called diverticulitis.
Oh, yeah, diverticulitis.
So, when you get a little bit older, sometimes,
Things start happening.
yeah, like little pouches, they form in your colon,
Right.
and those things can get inflamed, and that's what we're talking about today, diverticulitis.
Exactly.
And we have a pretty good set of sources here. We're going to try to give you the information you need so you understand what it is, what are some of the symptoms, and how is it managed. But we don't want to overwhelm you with too much information.
Yeah, just the essentials, the must-knows.
Absolutely. So maybe we should start with the basics. Like, what exactly is this thing, diverticulitis?
Well, it's basically an inflammation or infection of these small pouches in your colon. They're called diverticula.
Okay.
It's sort of like, think of them as little bulges, these weak spots in the wall of your colon,
Yeah.
kind of give them way. And these pouches, they're actually a condition called diverticulosis. That's what they are when they're just sort of there.
Mm-hmm.
But when they become a problem, that's when we call it diverticulitis.
Okay.
And it's more common than you might think. It can affect anywhere from 4 to 20% of folks who have diverticulosis.
Wow.
And it usually happens in this one spot called the sigmoid colon, which is down in the lower left part of your abdomen.
Interesting. So it seems like something that, as we age, it's more and more common.
Absolutely it is. In fact, we see about 188 cases per 100,000 people every year. And that number goes up as people get older.
Wow.
Yeah, in the U.S. alone, we're talking over 165,000 hospitalizations each year because of this.
And I'm guessing some of those cases get pretty serious, right?
Yeah, you're right. Around 15% of those folks end up needing surgery. And unfortunately, the mortality rate, people passing away from it, is about 1%.
So this is something that we should definitely be paying attention to. So I'm curious, why does this even happen? What causes these pouches to form in the first place?
Well, there are a few things that can put you at higher risk. One of the big ones is eating a lot of red meat.
Oh,
Yeah. And then there's your BMI. If you have a high BMI, especially if you carry a lot of weight around your belly, that can increase the risk too.
I see.
And of course, smoking, that's never good for anything.
Right.
And some people have certain connective tissue disorders, things like Marfan syndrome.
Mm-hmm.
Those can make you more susceptible too. And it's not just lifestyle stuff. Certain medications can actually increase the risk of a perforation, that's a hole, if you do develop diverticulitis.
Really?
Yeah, things like NSAIDs, ibuprofen and those kinds of pain relievers,
Wow.
opioids,
Uh-huh.
corticosteroids.
Okay.
So those are things to keep in mind. But the pouches themselves seem to form from, well, increased pressure inside your colon,
I see.
maybe from straining during bowel movements, if you're constipated a lot.
Mm.
And as we get older, that colon wall, it naturally weakens a bit. Gotcha. Okay, so that's why it's more common as we get older. Makes sense.
Yeah.
Now, let's say someone's listening and thinking, maybe I should be paying attention to this. What are the warning signs? How would they know if they might have diverticulitis?
Well, the most common things you'll see are a low-grade fever. So nothing too crazy, but, a little bit of a fever.
Okay.
And then pain,
Pain where?
specifically in the lower left side of your abdomen. That's kind of the classic combination.
Okay. Lower left pain and a fever. So what else? Any other signs that someone should look out for?
Yeah, sometimes you can actually feel a tender lump there. Your doctor could feel it during an exam. And people often notice changes in their bowel habits.
Like what?
Constipation is really common, but sometimes it can be diarrhea too.
Oh, interesting.
And there are some less common symptoms. Some folks experience more frequent urination, or they feel like they have to go all the time.
And there's even something called sterile pyuria, which is basically white blood cells in the urine, like you'd see with an infection, but there's no actual infection.
Wow, that's really interesting.
Yeah, it suggests there's inflammation going on.
Mm-hmm.
And then there's one very serious sign you should definitely watch out for. If you experience what's called an acute abdomen, that's a big deal.
What does that mean?
It could mean that you have a perforation, which is a hole in the colon, and that can lead to a really dangerous infection of the lining of your abdomen.
What's that called?
Peritonitis.
Peritonitis. Got it. Now, what about older folks or people with weaker immune systems? Would they experience the same symptoms?
That's a good point. In those cases, the symptoms might not be as clear-cut.
Oh, so it could be harder to detect.
Exactly.
Okay, so let's say someone goes to the doctor with some of these symptoms. How do doctors actually diagnose diverticulitis? How do they know for sure that's what's going on?
Well, Usually, if an adult comes in complaining of pain in the lower left abdomen, has a fever, and their blood tests show a high white blood cell count, doctors are going to suspect diverticulitis.
Right.
But to be absolutely sure, the best way is to do a CT scan of the abdomen.
A CT scan.
Right. And they use IV contrast with the scan.
What's that?
It's a special dye they inject through an IV to make the images clearer.
Oh, okay.
And what they're looking for on that CT scan are a few things. First, they'll see those outpouchings, the diverticula, in your colon.
Mm-hmm.
They'll also look for thickening of the bowel wall. Usually if it's thicker than 3 millimeters, that's a sign.
Okay.
And they'll check for any inflammation in the fat surrounding the diverticula.
I see.
And importantly, the CT scan can also show if there are any complications, like an abscess, which is a collection of pus, or a perforation, which we talked about earlier.
Right. That hole in the colon.
Exactly.
So CT scans are the gold standard.
Yeah, that's the preferred way to go. But sometimes they use MRI, especially if someone can't have a CT scan for some reason. And ultrasound can be another option. It's not as detailed as a CT, but it can be helpful for a quick assessment, especially if they're looking for complications.
Got it.
And sometimes they use regular x-rays.
Do those show diverticulitis?
Not always. They're not that helpful for uncomplicated cases.
Mm-hmm.
But if a doctor suspects a perforation or a blockage, an x-ray can be helpful.
Makes sense. You mentioned blood tests earlier. Are there other things they look for besides white blood cell count?
Yeah, they'll usually check your electrolytes to make sure those are balanced.
Mm-hmm.
They'll also look at kidney function markers, things like BUN and creatinine.
Okay.
And they'll measure something called C-reactive protein, CRP. It's a marker of inflammation.
Mm-hmm.
And if your CRP level is above 50 milligrams per liter and you have that pain in the lower left abdomen, there's a pretty good chance it's diverticulitis.
Interesting. Anything else?
Oh yeah, one more important thing. Once the acute episode, the immediate problem, calms down, it's really important to have a colonoscopy.
A colonoscopy. Why?
It's usually done about 6 to 8 weeks after you start feeling better. And the reason is to rule out any other serious conditions, like colon cancer.
That's a good reminder. Get those screenings done. Okay, so we've talked about what diverticulitis is and how it's diagnosed. What happens next? How is it treated?
Well, it depends. The treatment really varies based on whether it's uncomplicated, meaning just inflammation without any major complications, or complicated, meaning there are things like an abscess or a perforation.
Okay, let's start with uncomplicated. What happens there?
For uncomplicated cases, the first step is usually to give your bowel a rest.
What does that mean?
It usually means going on a clear liquid diet for a little while,
Ah, I see.
just to let things calm down. And of course, they'll give you something for the pain.
Pain relief. Makes sense.
Now, sometimes doctors will prescribe antibiotics, oral antibiotics,
What?
broad-spectrum antibiotics, the kind that target a wide range of bacteria.
Okay. But you said sometimes. Is it not always necessary?
It depends on the patient. If someone has a fever, or their symptoms just aren't getting better, or if they have a weakened immune system, then antibiotics are more likely to be recommended.
It's a sort of a case-by-case basis.
Exactly. And there are a few different antibiotics they might use. Common ones include metronidazole, combined with something like ciprofloxacin, levofloxacin, or trimethoprim sulfamethoxazole.
Those are some long names.
They are, aren't they? Sometimes they'll use amoxicillin clavulanate or just moxifloxacin by itself. And usually you take the antibiotics for about 4 to 7 days.
Okay, so that's for uncomplicated cases. What about the more serious ones?
Complicated diverticulitis is a whole different ballgame. Those folks almost always need to be admitted to the hospital.
Wow.
Yeah, and they'll get IV antibiotics right away, broad-spectrum antibiotics.
Through an IV, huh?
Yep. And then it depends on the specific complication. If there's an abscess, especially if it's 4 centimeters or larger, they might need to drain it.
How do they do that?
Sometimes they can do it percutaneously, which means through the skin with a needle.
Oh.
And sometimes it requires surgery.
And what about that perforation in that hole we were talking about?
That's a surgical emergency.
Mm.
You need surgery right away to fix that.
Wow.
And after someone recovers from complicated diverticulitis, they'll definitely need a colonoscopy.
To check how things are healing?
Yeah, and also to make sure there isn't anything else going on. And quite often, doctors will recommend surgery to remove the affected part of the colon, even if they were able to manage it without surgery initially.
So it sounds like it's really important to catch this early and try to prevent it from getting to that complicated stage.
You got it.
So if you're listening out there, what are the key takeaways?
Pay attention to the symptoms. If you're having pain in the lower left part of your abdomen and you have a fever, don't mess around. Get to a doctor. And remember, How it's treated depends on how severe it is.
It does. And these sources we've been looking at, they really give a comprehensive overview of diverticulitis. I mean, we've only scratched the surface here,
Right, there's a lot more to learn.
but hopefully this deep dive is giving you the essential information you need to understand this condition.
Absolutely. And, it makes you think, doesn't it? We talked about how diet and lifestyle seem to play a role in who gets diverticulitis. So what can you do to keep your gut healthy?
Yeah, that's something for everyone to ponder. Great question to end on. Thanks for joining us for this deep dive into diverticulitis. We'll see you next time.